when we talk about the getting ready for clinical trial and identifying patients, it's hard to find families and account for families really to know. We're getting asked a lot, Mike and I, how many families do you really, how many patients' families are really out there? And the best guess is, we point to the census, and that number is as of December 2024. And this is a really important number, right? Because those are families that we know we can reach out to. And the census is a great collaboration from all the different SYNGAP partners around the world, all the leaders, and then we come together, and Jess Duggan is the one organizing this and coordinating it. And every quarter, everyone shares their numbers, and then we put the SYNGAP census. But that means like these are families that are connected to organizations in some way or another, and then we can get in touch with those people. So that's an exciting number, right? It's not just we know of, we can actually get in touch with those families.
It's the only other thing I would say about this. Remember, no one is counting us except for us.
Nope.
Like when I started this, I asked the story it goes is true. When I was diagnosed, I asked who should have been one of the world's leading experts, how many patients are there? He said, well, 1 to 200. I said, oh, that's interesting, big range. Got on the Facebook group, new family diagnosed every week. A year later, I see the same guy, same conference. I said, how many patients now, doctor? 1 to 200. Well, you clearly aren't paying attention, because I know personally, I've only been here for a year. You've been studying this for a decade. I've been here for a year. I've seen 50 patients get diagnosed in the past year, and most of them have come to see you, doc. So if you had a clue, you would have just said 150 to 250. So now I know that you're making stuff up. And that's when I started the census. I said, they clearly, no one even knows the answer to how many patients we know about. So I emailed Verena in Germany and the people in the UK, all the things, and with help from Aaron Harding and Virginia and everyone else, all the OGs. And I put out a blog, and I said, I think this is how many Syngapians there are, but I'm sure it's too low. And my inbox blew up. You said there were 4 in Milwaukee. We used to do it by state. There's 5 in Milwaukee or whatever, Wisconsin, whatever. And state by state, city by city, people called and said, no, that number's wrong. And now we have this machine led by Jess. I couldn't do it anymore. I'm not smart enough. Jess Duggan now is in charge. But the point of this census is, yes, it's a powerful number, and it shows industry that we're growing, but it's more about this idea, to me, that we have to remind ourselves of. We do not have, I don't know, insert your 5 favorite diseases here, juvenile diabetes or heart disease or whatever. We have a random, very, very small, tiny, rare disease called SYNGAP1. And as a result, in addition to taking care of our loved ones, we have to also do other work. It's totally unfair. It doesn't make sense, but it is what it is. Yep. And one of those things we have to do is make sure we are counted, because we're not big enough for anyone to be counting us. So this census is more than a powerful number. That is exactly right. And it is us as a community taking ownership for our existence and making sure people know we are growing and that we matter and that we are worth counting. So that's another reason why we have to encourage every family we know and all of our clinicians who know other families to get connected, to get counted, because trust me, these numbers show up, and industry pays attention to this number very much. Lecture complete. Sorry.
Very good.